Hi, everyone. Happy Brain Injury Awareness Month. Happy Wednesday. I hope your week is going well. My name is Conor Gormally. I am one of the co-founders of Concussion Alliance. I'm going to be running the presentation mainly here today, but for our Q&A portion, which will not be recorded, we also have my co-founder, Malika Gormally. The recording won't be able to see you, but if you want to say hi, they can hear you, Malika.
Oh, hi. Welcome, everybody.
And also our program and operations associate, Zoe Marquis.
Hi everyone, thanks for being here today.
So for those of you who would like to receive a certificate of completion for this concussion advocate training workshop, please put your email in the chat at some point during this presentation. You can also send me an email at cg@concussionalliance.org, either now or if you're watching the recording afterwards. We would just ask if those of you who are requesting a certificate of completion, if you could mute myself, if you could, if for those of you who are asking for a certificate of completion, if you could make sure to stay through the presentation point. You don't have to stay for the Q&A to get the certificate of completion, obviously, but if you're watching this live or recording it, please try and stay through the whole thing to get that. Thanks everyone so much for that. And I am going to jump into it because we have a lot of fantastic information to show you all today. Okay, so a little bit about us. As I mentioned, my name is Conor Gormally. Unfortunately have been a concussion patient for the first time since 2012, but I've been dealing with persistent symptoms from a fourth concussion since 2016. I am a co-founder of Concussion Alliance and have been serving as a CEO for the last 4 years, I believe, 4.5 years. And then also, I want to give a shout out to Malika Gormally, who is a parent advocate and my fellow co-founder and has been serving as the COO. I want to again give an amazing shout out to our team, our staff, Concussion Alliance Program and Operations Associate Zoe Marquis, and our wonderful board, Dr. Elizabeth Sandel, Cam Gardner, Tom Walters, and Judy Lynn Walsh. We are lucky enough to have built a reputation in the space. I guess fortunate in being recognized by organizations like University of Rochester, UHN Krembil Brain Institute, Barrel Neurological Institute, even all the way over in New Zealand at the Auckland Institute of Technology and the AUT Traumatic Brain Injury Network. And our story and work has been featured in various publications in print and radio media, such as The Atlantic, Slate, Bloomberg, Oklahoma Educational Television Association, I believe, and NPR's Seattle regional partner, KUOW. So for those of you who aren't familiar with us, who are we? We are a concussion education advocacy nonprofit. Our mission is to create resources to help everyone impacted by concussions learn how to manage recovery and advocate for proper care, and of course, to inform healthcare providers on current best practices. Our programming, our website is the most comprehensive resource in the world for patients and caregivers. It's also used by a lot of healthcare professionals who recommend it to their patients because this is a really complex injury and providers don't get a lot of time in clinic with patients. We also have our biweekly concussion update newsletter, which is probably how many of you found out about this, that provides thoughtful synopses of recent research, calls for research opportunities to participate in research, and many other sort of news and opportunities in the concussion space. Our internship program for the past 5 or 6 years has been educating the next generation of researchers, healthcare providers, and public health professionals. Zoe was a 2024 intern alum before joining us on our team. And I also want to shout out Maybe more of you have joined since then. I haven't seen, but I want to shout out Carrie Hirano, who was I believe, 2021 summer internship alumni and is here joining us to watch the webinar. Carrie did some amazing work after graduating, both with us in terms of co-authoring a poster that we uh, uh, presented at the 2023 World Congress on Brain Injury in Dublin, and also working at her college as a student advocate for the Office of Accessibility Resources and as class president. And then we also are helping professionals stay up to date through, in the past, continuing medical education courses, and then also all of these resources. We've really seen a huge amount of impact with this work, which is amazing. Around 25,000 people a month visit our website. We have over 4,000 newsletter subscribers, about a third of whom are healthcare providers. We've worked with over 120 interns from 17 colleges and universities in the US, Canada, and Ireland. And then, of course, our continuing medical education course that I mentioned earlier, which is now expired, but still available as a free webinar, reached over 3,700 healthcare providers. 91% of whom indicated that they intended to make a practice change based on the program after watching it, at least those who filled out the form. We've also had many research collaborations with leading institutions, including Mass General Hospital, Harvard Medical School, and are currently a community partner with a multi-center 5-year NIH grant led by the University of Washington Biorepository and Integrated Neuropathology Lab in Seattle, as well as University of Utah. I just want to say, this is a huge endeavor. This is a massive undertaking. We obviously, can't do this alone, and this was really a multidisciplinary effort. And this is kind of the Alliance and Concussion Alliance. We're trying to bring together patient advocates, bring together professionals, bring together young people who are really interested and invested in this work and in this space, who want to go on and make an impact in it in their own lives and careers. And it just is a really wonderful thing. So I wanted to get through those so we had time to get to our workshop. Today we're going to be talking about how to be a proper concussion advocate in your community, in your workplace, among your peers, with your friends and family, etc. So we're going to go over this in a few different parts. Part one is really brief overview. What is a concussion and who gets them? So what is a concussion? This might seem like a simple question, but it actually is quite complex, and there's a lot of myths and misconceptions around what a concussion is and what needs to happen and what sort of it means when you get one. We know that they happen in the brain, right? But really, a concussion is a mild traumatic brain injury. For those of you who are concussion patients or professionals working in the space, you might be saying, yeah, of course, I know that. But that's actually something that isn't really that well understood. Additionally, it can occur when the head, but also the neck or body, so not just the head, experiences a blow that results in an impulsive force, like a wave of force energy being transmitted to the brain, that it causes the brain tissue to stretch, compress, and twist inside the skull. So it's not necessarily the brain hitting up against the inside of the skull. It's more about the forces causing the brain itself to stretch and compress and twist. And so this tissue movement causes a cascade of temporary chemical and physical changes that, along with musculoskeletal injury, because oftentimes your head is whipping forward, create symptoms that can affect how a person thinks, feels, acts, learns, and sleeps. Now, again, this is sort of, I think that there's a lot of complexity hidden in this. We don't really have too much time to go into it. We could run a whole workshop just on what is a concussion and how that definition has changed over time. But the main thing here to think about is that what's happening is that there is a force that is acting upon the body, any part of the body, not just the head, that is causing force to be transmitted. There's an impact, force is transmitted into the brain. The tissue in the brain stretches and compresses and twists, and that releases it creates all these chemical and physical changes that result in what we understand as concussion symptoms. We can talk about this all day long too. We literally ran a whole workshop about self-care during the holidays, looking at different symptom domains. But what is really important to understand is that these symptoms are really broad and that they're really individualized. They're sort of, we can categorize them, think of them, we like to think of them as these four different domains. So cognitive symptoms, which can be anything from brain fog and not sort of feeling off to short-term and working memory to trouble with numbers and counting to ease of overstimulation, mood and emotional symptoms, which are anything from kind of the impacts of recovery, but also, the mood and emotions are very much a big part of our brain's function. And so the actual injury itself can cause mood and emotional symptoms, not just the specifics, not just sort of the specific difficulties of the recovery process. There's what we call visual and vestibular. These systems are deeply intertwined. So this is how your brain understands where your body is oriented in the world, what is upright, how to stay on straight, and then also how your eyes function. And then, of course, physical symptoms. These are, headaches and neck pain, and all of the other, sensitizations that happen. I want to emphasize too quickly, I won't go through every single one of these, but it's really, really important as a concussion advocate that we understand, okay, when is this a concussion and when is this potentially something more serious? When you or, someone you know or see around you is experiencing concussion symptoms, that occur specifically after some kind of impact, a bump, blow, or jolt, these concussion symptoms mean that they should get to a licensed medical provider within the sort of next 48 hours, 1 to 2 days, and that they should be scheduling a follow-up in 7 to 10 days. But if we're seeing red flag symptoms, like particularly seizures and convulsions, slurred speech, severe increasing headache, weakness or tingling, one pupil being larger than the other. These are signs that this is maybe not a concussion, or in addition to a concussion, there's a more severe injury to the brain, such as a brain bleed or even a moderate or severe traumatic brain injury. That's something where they would need to go to an emergency room immediately because there might have to be emergency care. So how common is this? How common are concussions? And the answer is significantly more common than we think, and probably more common than we even know. There is epidemiology for concussions is hard, but a 2018 study that gets cited a lot looked at car accidents and rates of concussions in car accidents and rates of car accidents around the world. And their estimate put concussions, the incidence of concussions at 56 million concussions a year around the world. That's 1.77 concussions per second. So, in the last, 17 minutes, we've had nearly 2,000 concussions, 1,800 concussions statistically on average occurring since the start of this presentation worldwide. And that's really a lot. And we know that that's probably not even all of them because a lot of them don't get recognized or diagnosed. TBIs are a public health epidemic, and we know that they are at least 8 times more common than breast cancer, AIDS, MS, and spinal cord injury combined, which is just a wild statistic. But there's more. I'll go over these really quickly, but there were some fantastic polling and surveying work done in the US recently that found that between essentially 1 in 5 and roughly 1 in 3 adults surveyed reported a concussion in their lifetime. 6 to 14% of children surveyed reported a concussion in their lifetime. Persisting symptoms are really hard to measure. It's the variance is really wide based on what study you're looking at, but anywhere from 15 to 50% of people can get persisting symptoms. There were some really interesting statistics from University of Pittsburgh that found that as many as half of concussions go unreported. So if we're thinking about this slide back here, these numbers could be even higher. And then, as I mentioned earlier, we might take it for granted that concussion is a traumatic brain injury, but a Brain Injury Association of America poll from last year found that 81% of adults didn't know that a concussion was a traumatic brain injury, which is a really wild thing to think about, because if you don't know that a concussion is a traumatic brain injury, then you might not really take it as seriously as it needs to be taken. So who gets concussions? Everyone. I like to say concussions is not a sports injury, it's a physics injury. It does not discriminate. It does not discriminate based on race, sex, gender, class, um, uh, any qualities. Obviously, there are broader socio-political, socioeconomic factors that increase the risk of people getting concussions. There is a lot to get into there. I'm not saying that everyone is affected by concussions equally, but concussion is a physics injury. It's about again an impact translating force to the brain inside the skull, and that can happen to anyone. The most common causes of concussion, again, this is hard to know for sure, but we're thinking likely falls, motor vehicle accidents, and bike accidents. We don't understand this as well, but definitely assault and physical violence, especially intimate partner violence, which is very under documented. It's really difficult to study. And of course, sports injuries, because those are really a big part of the world of concussions, as much as we try and emphasize sort of the breadth of this picture. But again, concussion is a physics injury. It's not just a sports injury. If anyone can get into a car accident or fall off their bike or fall down the stairs, or there's these other things, and be in sport or survive assaults and all of those kinds of things. So getting into it, so we know we've established what a concussion is, and now we're thinking about, okay, what are we going to do? And these different parts are going to be broken down into the timeline. So we're going to start with what to do in the first 48 hours if you or someone you know gets a concussion. We really want to avoid outdated advice here. This is a big part of why Concussion Alliance exists, is because this is kind of the advice that we were getting. Rest in a dark room all day, resting until symptoms resolve is what a lot of doctors will still say. A lot of people will say to wear sunglasses indoors, and all of these tactics have been found to slow recovery. What used to be sort of widely recommended is now understood to be associated with longer recovery times, with increased average symptom burden, and with increased risk of persistent symptoms. It's also really important to understand, if you're being an advocate in your community, the concussions don't just happen with a direct hit to the head, like we talked about. You don't have to lose consciousness. In fact, 90% of 90% of concussions occur without a loss of consciousness. And they aren't just from sports. Again, we want to make sure that we're seeing a qualified medical professional in your primary care, with an urgent care, emergency department within 24 to 48 hours, as long as you're not experiencing red flag symptoms. And again, as far as these symptoms go, concussion symptoms may not appear right away. They might take up to 72 hours to appear. So a lot of people start getting, headache, or they feel off like 2 days later, and they might not associate it with a concussion. They might associate it with something else that happened in the intervening period. Oh, we double clicked because my computer's being slow. So first 24 to 48 hours, get checked by a qualified medical provider, have someone drive you, or take public transit, or take an Uber, or ask for friends for help paying for an Uber. Just don't drive yourself. This is when your system is really at risk for a secondary injury that can be much more severe. It's really important not to be behind the wheel of a car until you know what's going on. We also don't want to be, again, like we said, resting in a dark room or totally resting until something resolves. But we don't want to, be just continuing to push, 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 push. You do need some rest. So that's what we call relative rest. So relative rest looks like light physical and cognitive activities that don't result in more than a brief and mild worsening of symptoms. Brief and mild means that the symptoms don't get more than 1 or 2 points worse out of 10. And if you stop the activity, that they go back to what your sort of baseline symptom level is within about an hour. We're looking at reducing screen time to a total of 1 hour per day in the first 2 days, but still trying to stay connected, even if that doesn't mean screen time, or that doesn't mean going out. You can, it's crazy, I know, you can have a phone call with a friend. You could invite someone over to your place and have a really low-key thing. You could have someone come over and cook you dinner if you're not feeling up for that. And then that way you're eating good food and you're socializing in a controlled environment. It's really important to stay connected during this period. It's important to try and continue to do activities of daily living as long as you can tolerate them symptom-wise. But you still want to be getting rest and letting yourself sleep. We also want to make sure that you're notifying school or work or work that you've sustained a concussion and not attending school or going to work in those first 24 to 48 hours. And it's really important, again, to avoid all activities with a risk of fall, collision, or head impact. Again, this is the window when your brain is really vulnerable, and we don't want to be risking a secondary injury. And again, like I mentioned, some activities of daily living, walks, cooking if you can, dishes if you can, reading, as long as these things don't increase symptoms, there should be an asterisk there, more than 1 or 2 points out of 10. Sleep is important. Sleep is always important, no matter whether you have a concussion or not, but especially when you have a concussion, especially in that first 24 to 48 hours. Sleep problems after concussion are a risk factor for prolonged recovery. And so, we all, I'm sure, have heard about the benefits of good sleep hygiene, but they are really, really important here. So trying to have a consistent sleep wedge schedule, trying to avoid screens for an hour or two before bed, not having your phone in your bedroom, and then trying to stay in a cool, dark bedroom with minimal light or ambient noise, unless you're talking like white noise machine. So this person down here is practicing very good sleep hygiene. They're in a dark room. They've got an eye mask on just in case too. There is no phone in sight. I know this is a tight angle, but hopefully, no phone in sight. And they are going to be trying to go to sleep maybe a little earlier than usual, waking up maybe a little later than usual, but trying to have a relatively consistent sleep-wake schedule. Naps during the day, taking a little daytime nap is not a bad thing at all, as long as you're not sleeping all day in a way that makes it so you can't sleep at night. So that's part 2. So we know what to do in the first 24 to 48 hours. We're seeing a doctor, we're getting lots of good rest, but we aren't just laying in a dark room. We're continuing with some physical and cognitive activities like going for walks and doing some chores and activities of daily living. But we're making sure that all our activities are not resulting in more than a mild and brief exacerbation of symptoms. So beyond that period, we get into what's called the subacute phase. This is within 48 hours to a week. After this initial 48-hour period, what we want to start doing is gradually increasing physical activity. This actually promotes recovery. So this is part of how we found out that resting in a dark room or cocooning actually makes things worse, is that we found out that exercise makes things better. So we're talking mild intensity cardiovascular physical activity. So that can be walking, that could be using an elliptical or a treadmill, that could be cycling on a stationary bike. Ideally, a stationary bike. We don't want to be getting on a bike right after you have a concussion. That can be really dangerous. We're trying to mitigate things and avoid contact, collision, or fall risk. If you're having balance issues, these like recumbent stationary bikes that a lot of gyms have can be really, really helpful for that as well. Now, I just want to get into this in a little more detail because this is really, really important. And this is something that you can do for yourself. Ideally, of course, you want to be working with a physician or a physical therapist on this, but graduated aerobic exercise therapy, you can start on your own as long as you're making sure to really limit that fall risk and take care of yourself. But early concussion care, we know that graduated aerobic exercise can reduce symptoms, shorten recovery time, and reduce the risk of persisting symptoms. Now, what does that mean? This is a great example that was built out by Malika. We're thinking about, all right, we go outside to go for a little walk. Say it's the 3rd day after the injury. We mentally check in on symptoms, and right now symptoms are at a 4 out of 10. It's a little uncomfortable, but it's doable. We're going outside, and we decide to walk for about 15 minutes. And let's say, this is one of those days where even just like walking 15 minutes increases symptoms. At the end of about a 15-minute walk, you get back to your house and you are deciding whether or not to take another lap, and you check in with yourself and you're like, I don't know, I feel pretty uncomfortable right now. I say my symptoms are about a 6 of 10. So what you do now is you go sit down and rest. Now, within an hour, we go back inside and rest. And if our symptoms have gone back to about a 4 out of 10, that means that we were exercising at the right level and sort of we can continue progressing forward in this graduated process, right? But so that's what I'm saying here. Slightly more, if we're feeling really good, you can maybe even do slightly more exertion. But if your symptoms have not gone back down before, that means that what we did today was too much and we need to reduce the intensity of exercise tomorrow or later in the day, depending on the frequency that you're doing this with. And I think that this is really, really, really important to know. Um, Symptoms getting worse isn't necessarily a bad thing. Symptoms getting a lot worse means that you really overdid it and you might need to rest. But if there's not another significant impact, um, uh, we just have to remember that the system is really sensitive right now after a concussion. And so I know that there's a lot of fear about re-injury among concussion patients. And it's really, really important to recognize that some symptom exacerbation is what we're looking for. This is a rehabilitative injury. We wouldn't necessarily go to PT for an ankle injury, and if it hurts when we're doing our exercises for our musculoskeletal injury, that doesn't immediately mean that something is wrong. I think, been able to recognize that discomfort is part of a rehabilitative process for muscle injury, and the same is true for concussion. Um, Again, here we go. The goal is 30 minutes of moderate exercise daily, and we want to continue that track of exercising a level that mildly worsens symptoms, and they go back down to pre-exercise levels 1 hour after exercise. Again, just a note, if you're having dizziness or balance problems, running, being on a treadmill, even walking might be kind of higher risk for you if you maybe need to go for a walk with a friend. But another option is a stationary bike, or like I was talking about, those recumbent bikes. If you're having a lot of dizziness or neck problems, actually we'll talk about this later, but you want to be working with a physical therapist with concussion and particularly vestibular expertise. So within this process, it's really, really important to start getting back to life, right? Returning to work or school gradually after those 2 days for sure off, but with adjustments and accommodations. If it's possible for you to do half days at school or half days at work, and then gradually increasing screen time and work and school time as needed. Wearing sunglasses indoors is not good, and because it can essentially, your eyes can just get really, really used to having sunglasses, and it can make it harder for you to rehab sensory sensitivity. But if the overhead lights are a problem, which they are for a lot of concussion patients, you can wear like a ball cap indoors to protect against light overstimulation, or like wear earplugs to reduce sound stimulation. I had noise reducing earplugs on my keychain the entirety of college. Just a quick thing for parents. For students who have a concussion and are looking to return to school, we're talking about that relative rest, activities of daily living is tolerated, maybe some reading, a little bit of screen time, some cognitive activities, but not schoolwork. And then after that, you can start working, start working with the school to create a plan. It's not advised to actually keep your child out of school for over a week. And so we're trying to use these academic adjustments and accommodations to allow students to get back into the classroom, so that they're not dealing with all of the stress and pressure and social isolation of falling behind and not being with their peers. And then the students can maybe start doing some homework activities at home, even, if they're doing half days or if they can't make it back to school yet. Quick note on adjustments versus accommodations. Adjustments are often a lot easier to get. They're short term, they're informal, they're coordinated between the student and the teacher, whereas requesting academic accommodations is often more for students or with concussions who are dealing with longer term persisting symptoms, who are getting rehab for those symptoms, and they often require medical documentation required. It's a more formal process. But in both of these cases, we're talking about changes to schedule, classroom environment, or workload, changes that are personalized to fit the student's needs. A lot of teachers are a lot more willing to give academic adjustments for concussion than you might think, especially if the student or with their help from their family can advocate for what they need. Teachers are invested in students learning and having a good experience learning, and are willing to work with you to do part of that. Quick note on activities and sports. Returning to limiting, gradually increasing activity and sport at the same time as gradually returning to school, as long as we're talking avoiding fall and impact risk. I think a lot of people think that you need to be fully returned to school before you can before you can even start looking at a sporting field or sport specific activities. But the actually return to school plan and return to sport plan sort of happen at the same time, albeit with the caveat that medical clearance is required before starting any sport-specific non-contact drills that have any risk of contact. So players don't need medical clearance to be doing drills, on their own away from the rest of the team. But if they're participating in drills with the team, they need to be fully returned to school and they need to be medically cleared to return to activities that have a fall or contact risk. So, and then they get through those, then they go to full contact practices, and then they get to games. All right, I'm going to try hot button issue speed round. I'm going to try and keep this going quickly, but so here's a few hot button issues. Soccer, a lot of efforts have been made for no heading for up through U12, so that's 11 and under, and limiting heading up through U14. I think it's like 30 minutes once a week or something like that in practice. There is a big effort to move towards flag football, basically until high school. So for U14 players, and there have been some studies indicating that learning to tackle later does not have any limitation on the player's ceiling as an athlete, their ability to tackle safely. And then particularly hot button, the Q collar. You'll see a lot of athletes wearing this. Unfortunately, the evidence really isn't there. It can actually potentially be quite dangerous. You can check it out. We have a great blog post about it. And then Guardian caps, the evidence is very limited on this, and it's just in the version for pro and collegiate athletes. There is a separate version of Guardian caps for high schoolers, that would be the Guardian caps that high schoolers are using. And there really is no evidence that that one prevents or reduces risk of concussion. Okay, part 4. We're talking about now recovering within what we would call a typical window, which this might be a surprise for some folks, is 4 weeks. This is a big change in the most recent, although published in I believe 2024 now, consensus statement on concussion in sport. We moved from 2 to 4 weeks, 1 to 2 weeks for adults and 2 to 4 weeks for children. Now it's 4 weeks for everybody is a normal recovery timeline. So what does a typical recovery mean? I do want to emphasize that these consensus statements, there is no consensus statement on concussion. There is only the consensus statement on concussion in sport. So these recovery times are based off of athletes and oftentimes the experience of elite athletes, because elite collegiate athletes are a big part of who gets studied when it comes to concussion, because that's who universities have easiest access to. However, the pediatric living guideline for pediatric concussions, PEDS concussion, which is based in Canada and is one of the best resources out there, does say that 1 month is a standard to recovery for kids. I will say though that the research is indicating that non-sports concussions, especially more intense experiences like car accidents and assaults, often take longer to recover than a month. And anywhere between, we said 15 to 50, there's some studies as high as 59%, will have symptoms for over a month. But having persisting symptoms doesn't mean that you won't recover. That's a really, really critical thing as far as advocacy goes. Um, uh, it's really, really important to recognize that concussion isn't a thing that you get better from in a week. But if you have symptoms for even over 4 weeks, that doesn't mean that you're just not going to get better. It means that you need help. I'm hearing that we have a comment in the chat that saying I think it is longer with age. Yes, there is some evidence that young children bounce back, are more likely to bounce back sort of on the earlier part of that window. And then also, of course, older adults, when older adults get concussions, we just know that older adults often take longer to recover from injuries in general, and traumatic brain injuries are not uh, an exception from that. Okay, this is really, really important. This is where you, as a community advocate, can really step in and make a huge change in someone's life. Knowing when to seek care for persisting symptoms and helping patients in your community advocate for the care that they need, because it's very likely that they won't be getting these referrals from their point of care physician, is really, really critical. We're talking immediately, um, as soon as you see mental health struggles, especially in youth, there is a very high incidence of new or worsening mental health issues following a concussion. We're talking the actual like uh, uh, neurophysiological impact of concussion on the brain. We're talking about stigma from invisible injury. We're talking about isolation, disruption of routine, disruption of a very nascent like sense of self, especially in younger children, making sure that people seek care with a mental health professional. And additionally, to recognize that pre-existing mood issues are linked with wrong recovery. And then within 10 days, um, if patients are still dealing with headaches, dizziness, and neck pain, which are some very common symptoms in the first 10 days, and or sleep problems in the first 10 days, it's really important to start cervicovestibular therapy. So cervical is the neck, the cervical spine, and vestibular, again, that's that idea of balance and proprioception and orientation in space with a physical therapist. If you're having sleep problems, sleep dysfunction in the first 10 days, really important to get evaluation and treatment for sleep dysfunction because, again, sleep is where your body heals itself, really, in a really big way. It clears waste from the brain. It does so much important stuff. Um, so this is all really valuable, and this is all to say also that the reality of this headache, dizziness, and neck pain lasting 10 days, if you aren't an elite athlete, it can be time intensive to get a referral and get an appointment and get set up for care. So what we say is that if you're having headaches, dizziness, and neck pain, when you see that first provider in that first 24 to 48 hours, see if you can get a referral, or if that person isn't the person who can provide a referral for you, message the person who can, your primary care provider or another point of care provider for you, and ask for a referral to cervicovestibular therapy, because it's better to have it at 10 days and not need it than need it at 10 days and not have it. Because if you start looking into a referral at this 10-day point, it might be 2.5, 3 weeks before you can actually start getting care. And this is a really, really important window for rehabilitation. So again, when we're talking about concussion advocacy, how to be a really informed and proactive advocate, this is where you can really be a huge difference maker in the lives of people around you and in your community. These aren't the only symptoms that require rehabilitation, but those are the most sort of acute. Make sure that we get on top of those. Oftentimes, vestibular and visual symptoms go hand in hand. They can be treated by a physical therapist who is specialized in vestibular ocular reflex VOR PT. These symptoms, vestibular and ocular symptoms, do in many cases resolve on their own sort of over the course of that 4-week typical recovery timeline. But again, if it's been 2 weeks and you're still dealing with them, if you're feeling intense eye fatigue or double vision or blurry vision or sort of feeling disoriented in space or balance issues, it's really important to start that process of getting treatment for it. Um, the best person to work with for a vision therapist at this 4-week standpoint is a neuro-optometrist who has a certification from it's a funny name, COVID, the College of Vision Development, or NORA, Neuro-Optometric Rehabilitation Association. Those people are really the best. However, they often only take PPO plans if they accept insurance, and so it's better to see a physical vestibular therapist with vestibular ocular training than to see no one at all. And then just in general, if in this 2 to 4 week range your symptoms are not starting to get better, it's just important to seek care. And so we're going to talk a little bit about what that looks like. Persisting symptoms. This is also in terms of what we're thinking about in terms of seeking care. So this is if you have been doing these things, you've been getting this rehabilitation, or if you haven't gotten this rehabilitation and symptoms are not improving and it's been longer than 4 weeks. Officially at this point, what you're dealing with are persisting symptoms after concussion. A lot of people recognize, and the diagnosis is still post-concussion syndrome, but there actually has been a significant change in that because what we're dealing with is not a specific syndrome, but sort of a hyper individualized constellation of symptoms that are knock-on effects from a concussion. It is really sort of helpful to think about it because it's really hard to treat any sort of neuronal shearing or microstructure damage, but you can treat the symptoms of concussion, and these symptoms are persisting. Recovery is still possible in this phase, but you will likely need multidisciplinary help from rehab professionals. So at this point, when we're talking about this seeking care in this 2 to 4 weeks or in this 4+ week standpoint, you're trying to get to a multidisciplinary team. So how do you find that? One path is to ask for referral to one of these two kinds of clinics, a concussion clinic, preferably one affiliated with a major hospital or university. I'm here in Chicago. There are some really spectacularly good concussion clinics here in Chicago that are associated with like Rush, which is a major hospital group. Also, Northwestern has I'm forgetting the name, but Northwestern's Shirley Ryan Ability Lab is excellent. I'm sure that there are many others in Chicago, but ideally a major hospital or university. Or you can go, this is a thing that we wish we really knew about, to an outpatient rehabilitation clinic. A lot of times, these outpatient rehab clinics will mostly say that they deal with major traumatic brain injury, spinal cord injury, and stroke. But they typically have the team that is all set up to work with concussion patients. They often regularly work with concussion patients, and they often don't advertise that they regularly work with concussion patients. The other pathway for this is to ask for a referral to a specific type of healthcare provider. At Concussion Alliance here, we're very partial to physiatrists, which are physical medicine and rehabilitation, or PM&R doctors. PM&R doctors, along with neurologists and psychiatrists, are one of 3 specialties that can get subspecialty board certified in brain injury medicine. And physiatrists, given in their name, their specialty in rehabilitation, are very, very used to and often the kind of point person for a multidisciplinary team doing rehabilitation work for not just concussions, but all severities of traumatic brain injury and also stroke and other kinds of significant injury with a neurological component. Okay, I know I'm running short on time. Again, like I said, a lot of content we're almost through it, and we'll see if we can stay a little bit long for questions. Um, when you're looking for a clinic, you're wanting to make sure that a outpatient rehab clinic, that a concussion clinic, that a physiatrist that you're working with is going to refer you to, a physical therapist, ideally one with expertise in concussions, headache and neck pain, and visuovestibular therapy. Oftentimes, these clinics will have speech language pathologists. Um, SLPs don't just work with speech, they actually do cognitive rehabilitation after concussion, and a lot of them have expertise with concussion. These are a great referral for those things that I was talking about, like brain fog, like working memory issues. If you didn't used to need a list to go to the grocery store and now you do, or you are having trouble remembering things or remembering to do things or dealing with brain fog or feeling slowed down, speech language pathologists are one of the primary people who do cognitive rehabilitation. There's also neuropsychologists that do psychological and cognitive assessments, including memory. So those are big for testing those things. And then we really want to emphasize that occupational therapists do a lot because concussion affect a lot of how we move through the world. And so in addition to just schoolwork and sports, occupational therapists are really, really helpful for um, finding both like ways to compensate for issues and to rehabilitate issues related to the actual day-to-day activities that you're doing. Okay, this is our last and shortest part. I just want to give a shout out to our Navigating Your Concussion flyer with your community. If you're going to be an informed advocate, it shouldn't have to all be on you to remember all this stuff. And one of the great ways to do that is to use our Navigating Your Concussion flyer, whether that's, putting it up in your school, in the nurse's office, or putting it up on a board at work or in the community areas. This flyer is really, really helpful. It goes over a lot of the myths and concussion versus red flag symptoms that we talk about. And then this really, really important sort of the quick hits of what we've been talking about today, this avoiding outdated advice, the exercise and self-care guidelines, overview of what treatments exist for concussion, and then what to do in the first 24 to 48 hours, after 48 hours, and again, the stuff about when to seek additional care for symptom rehabilitation. So this can be a really, really helpful tool for you to use in your community to recommend people to get people to start thinking about this injury in a way that is current with sort of our current understanding of it, with current best practices for self-care and for rehabilitation. So, sum it up. A concussion is a very common injury. It can happen to anyone, and really is, as I think a lot of us in this space know, it can knock people off of their trajectory. It can alter the trajectory of someone's life, if symptoms persist in a really significant way. There are also a lot of injury issues around concussion being an invisible injury and invisible disability. Even short term, I think a lot of people are uncomfortable with the idea of considering the fact that they might have a disability when they're recovering from a concussion, even a temporary one. But traumatic brain injuries, including concussions, are explicitly listed under the Americans with Disabilities Act, under the ADA, as a cause of disability. And that, the idea of not being validated in your experience can be really isolating and stigmatizing. But early diagnosis, education, like what we're doing right here and what you are now prepared to do with your communities, and treatment can make a huge difference in terms of outcomes and make it so that people are less likely to get knocked off of their trajectories. And again, this is a multidisciplinary rehabilitative injury. There are many options to treat symptoms, and proper self-care is critical. Patient-centered care includes not just the provider listening to the patient and believing the patient's experience, but the patient also taking agency for their well-being, both in terms of advocating for the kinds of resources and treatment that they need, but also doing the work of the self-care that is intrinsically part of concussion recovery. Like, there are resources out there to support your recovery. It's really, really important. It can be so difficult. There's so many barriers to care. There's barriers to education. There's barriers to returning to school and work in ways that are actually helpful and not going in too fast. There are all of these different issues that make concussion recovery so it can make it really challenging, but there are resources out there to help, and we're aiming to be one of those for folks. Just a quick plug before we jump into questions. Don't forget, if you're not already subscribed, you can stay up to date on concussion news and research, the leading edge of it, with our Concussion Alliance newsletter. And then also, please, it is really a lot. It's a huge undertaking, and I know that we said it takes a village to do this, and part of it taking a village is our amazing community of supporters. We are a nonprofit that is entirely all of this work, all of these resources, workshops like these, our internship, our newsletter, they are all supported entirely from donations and support from our community. This March, because it's Brain Injury Awareness Month, we're asking that folks please consider, if you can. We know that a lot of concussion patients struggle a lot with lost income or high healthcare expenses, and not everyone has the ability to participate and support in this way. But if you do have the ability to support and participate in this way, please consider becoming a concussion ally by joining our monthly giving program. It's very convenient and flexible way to make a bigger impact. Monthly gifts sustain support, is predictable. It's critical to our year-round work. It allows us to plan for future programs and initiatives like these, and it has much lower admin costs than than grant writing, than recruiting major gifts and things like that. And it allows us to direct more resources towards our mission. So there's a QR code. There is a Become a Concussion Ally link. It's linked on our website. Please consider it. We're hoping to add some more concussion allies to our community in the month of March during Brain Injury Awareness Month to have our community come out and show support for what we're doing, and that it is important and it is necessary and it is supported by the people who recognize that. So thank you all so much for this. I'm going to stop the recording now, and I'm happy to stay on a little bit longer to answer questions for folks. So thank you all so much for attending. For those of you who are watching this recording, thank you so much for taking the time to watch the recording. Again, if you would like to get a certificate of completion for taking this recording, we will send out personalized certificate of completions for everyone who made it this far. So if you haven't already for the live recording, please don't forget to drop your email in the chat. And if you are watching this recorded, if you can send us an email at this point letting us know that you've completed it, and we will get that to you. So thank you all. Thank you so much, everyone. It's amazing to see how many people showed up and showed out for this. I think we have 23 people in our audience who've taken an hour of their Wednesday to be part of this. I'm going to stop the recording now, and I'm happy to start answering some questions.